and today I will inform you on the effects that alcohol has on the body. Does anybody in the room drink, have had a drink before, or know someone who drinks?
Yeah, I know someone who drinks.
Well, as a college student, we may all have experienced at least once a party or an occasion where alcohol has been present. Due to this reason, I am speaking of this topic to inform you all how alcohol can affect our bodies. Today, I will cover how alcohol can affect your body emotionally, physically, and the consequences of long-term alcohol use. There is a misconception that alcohol only affects your liver, but alcohol affects many different parts of your body as well. The more alcohol an individual consumes, the more of an effect it has on their system. Alcohol has different effects on the brain. Some impairments can start within just 1 or 2 drinks and is resolved within an hour when drinking stops. These impairments include difficulty walking, blurred vision, slurred speech, slower reaction times, and impaired memory. College students are particularly at a risk for experiencing a blackout, which is an interval of time for which the intoxicated person cannot recall key details of events or even the entire event. Binge drinking for a typical adult is defined as consuming 5 or more drinks in about 2 hours for men, or 4 or more drinks for women. Not only can blackouts occur because of binge drinking, they can occur due to drinking on an empty stomach because of rapid emptying, which means the alcohol hits your bloodstream much faster and in greater concentration. People who drink large amounts of alcohol for a larger period of time risk the development of more serious and persistent changes in the brain. Some examples include thiamine deficiency, which is vitamin B1, and it's an essential nutrient required by all tissues. From this deficiency, you may go on to develop a more serious brain disorder called Wernicke-Korsakoff syndrome, which is a disease that consists of 2 separate syndromes in your brain. Alcohol can also be very bad for the developing brain seen in pregnant women. If a woman is pregnant and drinks, she risks her child developing fetal alcohol syndrome. Children with fetal alcohol syndrome may develop distinct facial features, are smaller than average, and have fewer brain cells. These points about alcohol effects on the brain are quite significant, but alcohol does not only affect the brain, it also affects the body physically. Alcohol being one of the most frequently consumed substances in the world, you would not think it can lead to many serious issues. But in the heart, drinking a lot over time or too much within a single occasion can cause cardiomyopathy, arrhythmias, stroke, and high blood pressure. Chronic drinkers are likely to develop throat, mouth, or esophagus cancer. The commonly known alcohol effect is cirrhosis of the liver. Fatty liver, alcoholic hepatitis can also be developed. Most importantly, alcohol alone can in fact weaken your whole immune system, making your body a much easier target for disease. According to the NIAAA, women are more vulnerable than men to many of the medical consequences of alcohol use. Men who drink excessively can experience problems with erectile dysfunction, and alcohol appears to inhibit testosterone and other hormonal secretion. With all these effects alcohol has, you would expect that the drinking rates are fairly low, but they are in fact fairly high. According to the NIAAA, by the age of 15, about 29.8% of teens have had at least 1 drink. By age 18, about 58.0% of teens have had at least 1 drink. And in 2018, 7.1 million young people ages 12 to 20 reported that they drank alcohol beyond just a few sips in the past month. Drinking is higher among college students. In fact, 1,825 college students between the ages of 18 and 24 die from alcohol-related unintentional injuries, including motor vehicle crashes. So in conclusion, I hope that you're more informed on the effects of the body alcohol has physically and emotionally. Thanks.